India has achieved an impressive feat of administering 2 billion COVID-19 vaccine doses to its citizens. The country has now become the second nation to achieve this milestone after China. As per government data, the second most populous country in the world achieved the vaccination milestone in just 18 months. India began its vaccination drive on January 16, 2021. The vaccination count includes data of all those who have received at least the first dose, along with those that have been administered the second and third booster dose. Nearly 71% of the 2 billion vaccine doses in India have been administered in rural areas, while 48.9% vaccine doses have been given to females, ensuring parity on all levels. Here's a look at the timeline of India's key milestones in its fight against COVID-19. On January 16, 2021, India rolled out its vaccination drive by prioritizing health and frontline workers. India crossed 100 million mark of administering COVID-19 vaccine on April 11, 2021. India crossed the 500 million feet on 6th of August 2021. Then the milestone of reaching 1 billion administered COVID-19 vaccines was reached on 21st of October. And on January 7th, 2022, India crossed the 1.5 billion mark of administering COVID-19 jabs. Reaching this humongous task of administering 2 million COVID-19 jabs to its citizens was not easy. That is 2 billion, not 2 million. India had to strategically prioritize giving out the COVID vaccines in a phased manner to those who were more susceptible to getting the virus. There are only 4 COVID vaccines available which have been approved by the government of India, namely AstraZeneca's Covishield, domestically developed Covaxin and Cobivax, and Russia's Sputnik V. We're now being joined by Dr. Manohar Agnani from New Delhi. He is Additional Secretary and Chairperson Interim Commission for Allied and Healthcare Professions. Doctor, thank you very much for making time and welcome to WION.
Thank you.
India sees this as a momentous milestone. As a doctor, how do you see this 2 billion doses achievement?
It's a proud moment for all of us. I would attribute it to Team Health India. It's a classical example of how a team building, team comprising of not only the health professionals, but other frontline workers, NGOs, the organizations, civil society organizations, and government working together towards a common goal. So it's a proud moment indeed.
Doctor, what are your views on vaccine hesitancy? Some countries faced that hurdle, but not India.
So yes, you are right. To be honest, when we started our COVID vaccination program, National COVID Vaccination Program on 16th of January last year, we had some doubts about the vaccine hesitancy. So we started working on this vaccine hesitancy part from the beginning. We came out with the communication strategy where we said that not only we will focus on COVID appropriate behavior, vaccine eagerness, but also we will focus on vaccine hesitancy. And if you see, if you want to really work on vaccine hesitancy issue, you have to involve the entire society. And we had meetings with healthcare professionals. We cleared the myths and misconceptions around vaccine, especially for COVID. We had meetings, discussions with the state governments, provincial governments, local governments. We solved their concerns. We had meetings with the civil society organizations, NGOs, the Panchayati Raj institutions, and so on. And we wanted to understand what could be the possible reasons for vaccine hesitancy and try to address those issues in a systematic manner. And we actually came out with a very effective communication strategy much before we started the actual vaccination.
Right. Dr. Manohar, the Indian government also initiated free COVID vaccines. How crucial was that in reaching out to the masses?
So as you said that we started with the electronic platform, which is, we call it CoWIN. And we were sure that we will have to go to the rural masses. We will have to cover the far-flung areas. So we made a very simple protocol for that. We involved all the Panchayati Raj institutions, NGOs, and civil society organizations, and we made up around 30,000 cold chain points. So there was a very effective strategy that we not only vaccinate people, but we also ensure that there is sufficient infrastructure available in far-flung areas, and those who are the vaccinators, they are sufficient in number. They were trained on these issues. They were trained on issues related to adverse events following immunization, and our entire focus from the beginning was that we will begin on the day one in entire country, be it a rural area or an urban area, be it a part of the city or a far-flung area, and then our strategy has worked out.
India has constantly modified its vaccination methodology in tune with new studies, the latest being reducing the gap for COVID booster shots from 9 to 6 months. How do you see India's overall vaccination policy?
So our vaccination policy has been very real-time. It has been dynamic. It is based on evidence, and it is also working on the science. So from the very beginning, our Honorable Prime Minister announced a group which is called National Technical Advisory Group for Immunization, which was already working on Universal Immunization Program. And we also came out with the organization called National NEGVAC, we call it, E-Group for National Group for Vaccine Administration and Communication. And these two bodies, these two institutions really work on real-time basis. And NTAGI is the body which is empowered to take decisions and suggest that what would be the vaccine strategy. And when we, NTAGI decided that it is a long time that Indian citizens have been vaccinated for the second dose and we need to give them additional immunity, they discussed in their meeting and came out with a reduced interval between second dose and the precaution dose of 6 months rather than 9 months, which was the earlier practice. So it has been based on the evidence and science.
Finally, Doctor, the WHO says the pandemic is changing but not over. COVID cases rising in 110 countries. Your brief advice to the world?
So our advice would be that COVID-appropriate behavior will always prevail. We need to, that's something which we have learned and we should continue to practice. That is something which has COVID pandemic has taught us. Second, of course, is the role of the vaccination. It has shown in our country also when we had the pace of vaccination going up, the number of COVID cases came down. Even if those who are infected, there were less seriousness of the less severe cases and less hospitalization and less mortalities. So my message would be that we have to be vigilant, we have to be cautious, we have to maintain our COVID appropriate behavior. We should continue to have vaccination done and we should not take it lightly. But if we have a combination of all this, probably we can have a new normal life, which WHO advocated to begin with.
Additional Secretary and Chairperson Interim Commission for Allied and Healthcare Professions, Dr. Manohar Agnani, thank you very much for making time and for talking to WION today.
Thank you.
WION is now available in your country. Download the app now and get all the news on the move.